Look at your tongue right now, before coffee changes its surface. Do not wait until toothpaste scrubs away the overnight evidence. Stand before a mirror, open your mouth, and use bright, natural light. Stick your tongue out slowly, then study what you usually ignore. Most people only glance once, then close their mouths and move on. They check wrinkles, gray hair, swollen eyelids, and belly fat daily. Yet the tongue stays hidden, working constantly, ignored for decades. That neglect becomes a serious mistake after the age of 50. Your tongue is not just muscle for speaking and swallowing food. It is living tissue, wet, vascular, sensitive, and constantly renewing. Few body surfaces reveal internal changes this clearly every morning. No scan is needed, and no appointment is required first. You only need a mirror, good light, and honest attention. A clinician inspects the tongue because it can carry warnings. A returning white coating may not be simple dirt or laziness. A smooth, burning tongue may not come from spicy food. A new, deep crack may not be harmless aging. Teeth marks along the edges may not be random pressure. A sore that stays may not need pain to be dangerous. People trust pain far more than they should. They believe serious disease must announce itself with loud suffering. But many conditions begin quietly, with small visible changes first. The body whispers long before it finally starts shouting. Most people were never taught how to hear that whisper. I have watched patients ignore mouth changes for many months. A burning tongue was dismissed as irritation from toothpaste. White patches were blamed on poor brushing and morning breath. A cracked, dry mouth was explained as normal aging. A painless sore stayed on one side and slowly changed. The patient waited because the sore did not hurt. That is how early warnings become late diagnoses. The tongue alone cannot diagnose diabetes, cancer, anemia, or deficiency. Medicine is more complex than any bathroom mirror. But the tongue can show clues worth following. Clues tell you where your attention should move next. Before reading those clues, we must destroy one common myth. A strange-looking tongue does not always mean poor hygiene. You have heard that simple explanation your entire life. White tongue means brush harder and buy stronger mouthwash. Bad taste means your mouth needs a more powerful rinse. A red surface means last night's food was too spicy. Cracks mean you are older, so nothing can be done. Sometimes those explanations are enough, and nothing serious is happening. But after 50, the mouth becomes a different environment. Saliva often declines, and medications begin to accumulate. Blood sugar becomes less forgiving than it was at 30. Dentures, mite guards, and dental appliances become more common. Stomach acid may fall, and vitamin absorption can weaken. Sleep breathing changes, and mouth breathing can become more frequent. The immune system also shifts with age and illness. So the better question is not whether you brushed enough. The better question is why this surface changed now. To answer that, understand what you are actually seeing. The tongue surface is covered with tiny projections called papillae. They create texture, help taste, and move food during chewing. Below them run dense networks of blood vessels and nerves. The lining renews quickly, so it reacts quickly to stress. Moisture, nutrition, blood flow, oxygen, and immunity all matter. When saliva dries, the tongue becomes sticky, coated, and dull. When nutrients fall, the surface may become smooth and sore. When oxygen drops, the color can darken in concerning ways. When yeast grows unchecked, white patches may appear and return. When tissue stays irritated, a sore may refuse to heal. This is not superstition, tradition, or internet guessing. This is anatomy, visible in a place you can inspect. Now look at the tongue again with that understanding. The first warning pattern is a white coating that returns. A thin, pale film in the morning can be normal. During sleep, saliva slows and cleaning becomes less active. The back of the tongue collects bacteria, cells, and debris. If it clears easily, it may not be serious. Water, gentle cleaning, and oral care usually improve it. A thick coating that returns daily tells another story. Then the coating is no longer the main subject. The real subject is the environment that keeps producing it. Your mouth has a cleaning system, and that system is saliva. People think saliva is only spit, but that is wrong. Saliva washes the tongue and protects the teeth from acid. It carries immune proteins and helps control bacteria and yeast. When saliva weakens, the mouth becomes a different room. Food residue lingers longer, especially along the back surface. The tongue feels sticky instead of smooth and alive. Breath turns sour faster, even after careful brushing. Dentures rub against tissue that no longer has enough lubrication. The person brushes harder, yet the morning coating returns. The brush was never the whole answer. The room became too dry for self-cleaning. After 50, dry mouth is often related to medications. Blood pressure drugs, antidepressants, allergy pills, and sleep aids matter. Bladder medications, pain medicines, and decongestants can also reduce saliva. A patient starts one prescription, then slowly adds several more. The blood pressure improves, or sleep becomes slightly easier. Meanwhile, the mouth quietly loses its protective moisture. The tongue becomes the receipt for that hidden change. There is another white pattern that deserves serious attention. Creamy white patches may appear on the tongue or cheeks. They may also sit on gums or the mouth roof. Sometimes they wipe away, leaving a red, sore surface. Sometimes they burn, case-strange, or split the mouth corners. That pattern can point toward oral thrush, a yeast overgrowth. Yeast normally lives in the mouth in small amounts. Trouble begins when the normal balance breaks down. High blood sugar changes the chemistry of the mouth. Dryness removes the washing system that keeps organisms controlled. Antibiotics can disturb the normal bacterial population. Steroid inhalers may leave residue without proper rinsing afterward. Dentures that are not cleaned well can become reservoirs. Recurring white patches in older adults deserve careful thought. They are not only cosmetic, dirty, or embarrassing. A stronger mouthwash may feel clean for 20 minutes. It does not correct high blood sugar or restore saliva. It does not clean dentures throughout the night. It does not reverse a drying medication by itself. Treating the surface alone is like wiping mold from wallpaper. The leak behind the wall still remains untouched. The second warning pattern is a smooth, red, burning tongue. This problem often begins with sensation before clear appearance. Toothpaste suddenly stings, and coffee feels strangely sharp. Spicy food becomes harder to tolerate than before. The tongue looks polished, almost bald, under good light. The small surface bumps seem flattened or completely missing. Taste may become metallic, dull, bitter, or simply wrong. The medical word is glossitis, meaning inflammation of the tongue. Several conditions can cause it, so context matters. After 50, I pay special attention to nutrient deficiency. Vitamin B12, iron, and folate are especially important. These are not fashionable supplement words from advertisements. They are building materials required by the body. Healthy blood cells, nerves, and fast-growing tissues depend on them. The tongue renews quickly, so shortages may appear there early. Vitamin B12 deserves particular attention in older adults. Absorbing B12 is not as simple as swallowing food. The body needs stomach acid and a protein called intrinsic factor. It also needs a functioning small intestine to absorb properly. At 25, this chain often works quietly and efficiently. After 50, the chain can break in several places. Metformin can affect B12 status in some patients. Digestive surgery can change how nutrients enter the bloodstream. A strict diet may reduce animal protein sources of B12. Some people have autoimmune stomach disease without knowing it. The tongue may become the first visible witness. The surface turns smooth, red, sore, and sensitive. Burning appears, then paste changes, then mouth corners crack. Later, numb feet or tingling hands may begin. Balance problems, fatigue, memory complaints, or anemia may follow. By then, the deficiency has likely been developing quietly. Iron deficiency can create a similar clinical picture. The tongue becomes sore, smooth, and more easily irritated. Fatigue arrives, but fatigue is easy to dismiss. People blame age, stress, poor sleep, or inactivity. Then stairs feel harder, and the heart races faster. Males may become brittle, while the mouth feels raw. One small clue matters more inside a larger pattern. A burning tongue alone does not prove deficiency. Burning with fatigue, tingling, paleness, or breathlessness deserves attention. A restricted diet adds another reason to ask questions. A complete blood count may be worth discussing. Ferritin, iron studies, B12, folate, and thyroid testing may help. Do not drown a supply chain problem in mouthwash. The third warning pattern is a dry, cracked tongue. Some people naturally have grooves on the tongue. One central crack can remain unchanged for many years. No pain, no change, and no other symptoms may reassure. But a new crack after 50 deserves attention. A moist surface becomes sticky, dull, and uncomfortable. Grooves appear where food begins to collect. The tongue sticks to the roof of the mouth. Dry crackers become difficult without water nearby. Speech feels uncomfortable, especially during long conversations. Dentures that once fit well suddenly begin rubbing. This is not simply thirst or poor brushing. This is a lubrication problem inside the mouth. Saliva protects the mouth like oil protects an engine. Without enough lubrication, friction rises and tissues lose resilience. Small injuries accumulate where surfaces used to slide easily. Food particles stay trapped longer inside tiny grooves. Bacteria find hiding places, and yeast finds opportunity. The tongue burns because the protective film has thinned. Dry mouth after 50 has several common roots. Medications are common, but they are not alone. Diabetes can contribute by changing fluid balance in saliva. Sjogren's disease can attack moisture-producing glands directly. Mouth breathing during sleep can dry tissue for hours. Snoring and sleep apnea can worsen the morning dryness. Radiation treatment can damage salivary glands permanently. Chronic underhydration makes every other cause feel worse. Many people worsen dryness while trying to avoid nocturia. They stop drinking water because nighttime urination bothers them. By evening, saliva thickens and the tongue feels cracked. Then they drink too much right before bed. At 3 in the morning, the bladder wakes them again. They conclude that water itself is the enemy. Water is not the enemy in this situation. Timing is the real issue for many people. Drink earlier, then reduce large fluid loads before sleep. Persistent dry mouth deserves medical and dental attention. Alcohol-based mouthwash often makes the dryness worse. Tobacco dries tissue and adds chronic irritation. Some whitening products and harsh rinses aggravate the surface. A dentist can recommend products that protect without burning. A stable fissured tongue may simply be anatomy. A newly dry, sticky, burning tongue is a message. The fourth warning pattern is teeth marks along the edges. Most people inspect only the top of the tongue. That misses an important part of the story. Look carefully at both sides of the tongue. If the borders are wasy, the teeth left impressions. The tongue has pressed against the dental arch repeatedly. Those marks are pressure records, not decoration. Sometimes the jaw is simply narrow or crowded. Sometimes the person clenches their teeth during sleep. Sometimes they grind at night without remembering anything. Sometimes the tongue is swollen or slightly enlarged. Fluid retention can make soft tissues puffier by morning. Low thyroid function can sometimes create a thick tongue. Sleep breathing problems can also be part of the picture. The tongue can record what happened while you were unconscious. A person wakes exhausted and insists they slept 8 hours. Their spouse says snoring shook the room at night. The mouth is dry, and the morning headaches. Blood pressure remains high despite several reasonable medications. Along the tongue edges, teeth have left small half moons. That combination deserves a more serious conversation. Sleep apnea is not just snoring. Snoring is only the sound of the problem. The deeper issue is repeated airway narrowing during sleep. Oxygen dips, pressure swings, and stress hormones follow. The tongue sits inside that airway system. If it crowds the throat, breathing becomes real work. The person wakes tired, and blames age. The tongue may have recorded the nightly fight. A scalloped tongue alone diagnoses nothing by itself. It does not prove sleep apnea or thyroid disease. Medicine never works from one sign in isolation. A sign becomes meaningful when it travels with others. Scalloped edges with loud snoring point toward the airway. Morning headaches and daytime sleepiness strengthen that question. Dry mouth and resistant blood pressure add more weight. Fatigue, constipation, cold intolerance, and dry skin point elsewhere. Weight gain and a hoarse voice raise thyroid questions. Jaw pain, worn teeth, and facial tension suggest grinding. The edge of the tongue is evidence of pressure. Your job is to learn where pressure originates. The fifth warning pattern is unusual color. Color is tricky because whiting lies easily. Coffee stains, wine stains, berry stain, and candy stains. Some medications can also fool the eye temporarily. A single glance under bad bathroom light is not enough. Persistent color changes deserve more respect than that. A pale tongue matters when the whole person looks pale. Fatigue, dizziness, breathlessness, rapid heartbeat, and cold hands matter. Pale gums make the finding more significant. Blood gives the tongue much of its pink tone. When hemoglobin falls, that healthy color can fade. The change may be subtle rather than dramatic. The surface simply looks washed out, less alive. That quiet fading can belong to anemia. A bright red tongue tells a different story. When it is smooth and sore, think inflammation. Nutrient problems, irritation, infection, and allergy can all contribute. A moving red patch with pale borders may be geographic tongue. That pattern is often benign, although it can burn. A fixed red patch that persists belongs elsewhere. Blue or gray changes the urgency completely. Food dye can temporarily fool the eye. But genuine blue-gray tissue with breathlessness is different. Blue lips, confusion, chest pain, or severe weakness are urgent. Trouble breathing makes this a medical emergency. Oxygen changes the color of blood. When oxygen delivery fails, vascular tissues may darken first. Lips, tongue, and fingertips can reveal that problem. Emergency clinicians check these areas for good reason. They do not provide the final diagnosis. They tell you the body may be in trouble. Do not wait with blue lips and breathlessness. Do not drink tea and hope the shade changes. Do not casually drive yourself to a clinic. Get urgent help when breathing and color change together. Then there is the frightening color, black or brown. A black tongue often looks far worse than it is. Many people imagine poison, decay, or severe infection. Often, the papillae have simply become elongated. They trap pigment, debris, bacteria, yeast, and tobacco residue. Coffee, tea, and certain medications can darken the surface. This is often called black, hairy tongue. It is not hair growing from the tongue. It is an overgrown surface collecting stain. Dry mouth, smoking, antibiotics, and bismuth medicines can contribute. Heavy coffee or tea can make the color stronger. Poor oral cleaning allows the buildup to remain. Gentle cleaning, hydration, and trigger removal often help. A dentist should examine it if it persists. Even when benign, black tongue still tells a story. The surface stopped shedding and cleaning itself normally. The mouth became dry, stained, altered, or neglected. The color is only the headline. The mouth environment underneath is the real article. The sixth warning pattern is a sore that does not heal. This is the rule I want you to remember. A tongue sore lasting beyond 2 weeks needs evaluation. The same applies to red patches and white patches. A firm lump, rough area, or bleeding spot also matters. Thickened tissue or numbness in one area matters too. 2 weeks is the rule, not 2 months. Most small injuries in the mouth improve quickly. A bite improves, and a burn usually settles. A sharp chip injury should start healing with time. A denture sore improves when the pressure is removed. Tissue that refuses to heal asks another question. Oral cancer and precancerous lesions can begin quietly. That quiet beginning is exactly what makes them dangerous. A painless sore may sit on one tongue side. A white patch may look like ordinary irritation. A red, velvety area may seem minor. A lump may hide underneath where nobody looks. People wait because the area does not hurt. That is the exact mistake that costs time. Risk is higher with tobacco and heavy alcohol use, but age, HPD-related disease, immune suppression, and chronic irritation also matter. Sharp teeth and poor dentures can keep tissue injured. But no risk factor list makes a persistent lesion safe. Non-smokers can develop oral cancer. Healthy-looking people can develop oral cancer. Pain-free lesions can still be serious. The mirror cannot tell you which patch is safe. A trained examination can narrow the possibilities. Sometimes a biopsy is needed to end guessing. Biopsy is not the enemy in this situation. Late guessing is the real enemy. Lift your tongue and inspect underneath carefully. Check both sides, especially where teeth rub. Use a flashlight if the room is dim. If one suspicious area stays beyond 2 weeks, go. See a dentist, oral surgeon, ENT doctor, or physician. Persistence is the warning you should not negotiate with. The 7th warning pattern is a moving map-like tongue. Not every strange-looking tongue is dangerous. This matters because fear without judgment helps nobody. A condition called geographic tongue can look alarming. Smooth red patches appear with pale or whitish borders. The shapes can resemble islands on a map. One area clears while another area appears later. Spicy or acidic foods may cause burning. In many people, geographic tongue is benign. It is not contagious, and it is not cancer. It may be uncomfortable, but it behaves differently. Behavior is the key to reading it. A moving pattern differs from a fixed growing pouch. A bite should heal within a reasonable period. A burn should settle after the injury passes. Thrush often has a creamy surface and wider involvement. Dry mouth creates a sticky and cracked landscape. Nutrient problems often create smooth, burning sensitivity. Clenching leaves impressions along the tongue edges. Suspicious tissue tends to stay, thicken, or bleed. It may grow, harden, or refuse to heal. Do not fear every mark you see. Watch how the mark behaves over time. Does it move, heal, wipe away, return, or bleed? Does it sit in one place and refuse to leave? A photograph can answer more clearly than memory. Take one picture today under good light. Use the same angle, distance, and lighting later. Take another picture in 2 weeks. Memory edits reality, but photographs preserve the comparison. Now let us make this practical. 5 minutes once a week is enough. Morning is best before brushing, coffee, or food. Use natural light whenever you can. Bathroom bulbs often distort color and create false impressions. Start with the general surface of the tongue. Notice whether it is moist, sticky, coated, or clear. Notice whether it is rough, smooth, dull, or shiny. Compare the back of the tongue with the front. Then study color, but compare yourself to yourself. Do not compare your tongue with perfect internet photos. A pale surface matters more when fatigue travels with it. A red moving patch differs from a fixed red patch. Check both sides, where teeth often leave marks. One-sided irritation may come from a sharp tooth. One-sided irritation may come from a sharp tooth. A broken filling or denture edge can also rub. Correct the obvious source when you can. If the lesion remains, do not negotiate with it. Lift the tongue and inspect the hidden surface. Most people never look there at all. That is exactly why trouble can hide there. Pay attention to what the tongue feels like. Burning, numbness, altered taste, or spicy food pain matters. Difficulty swallowing or tongue enlargement also deserves attention. Connect those feelings with what you can see. Use the 2-week rule for suspicious findings. Anything concerning that remains beyond 2 weeks gets examined. Now here is what to do after watching. Clean the tongue gently, not aggressively. It is living tissue, not a dirty pan. One gentle pass with a scraper or soft brush is enough. If you scrape until bleeding, you create inflammation. Protect saliva as seriously as you protect teeth. Drink earlier in the day, not all at bedtime. Avoid harsh alcohol-based mouthwash if your mouth is dry. Ask whether medications may be drying your mouth. Dry mouth products can help some people significantly. Persistent dryness deserves attention from a dentist or physician. Clean anything that sits inside your mouth. Dentures, retainers, night guards, and inhaler residue matter. A dirty appliance can keep tissue inflamed for months. Connect mouth signs with whole body signs. A white coating after mouth breathing means one thing. White patches with thirst and frequent urination mean another. A burning smooth tongue matters more when feet tingle. A pale tongue deserves attention when stairs become difficult. Teeth marks matter more with snoring and morning headaches. Do not self-treat emergencies at home. Blue lips, chest pain, confusion, or severe weakness need care. Trouble breathing or difficulty swallowing belongs in medical hands. Unexplained weight loss or a growing lump also matters. Your tongue is not disgusting or random. It is not merely something to brush before leaving home. It is living tissue connected to blood and saliva. It is also connected to nerves, digestion, breathing, and immunity. A dry morning tongue may tell a saliva story. A smooth, burning surface may reflect a nutrient problem. A returning white coating may reveal an altered mouth environment. A row of teeth marks may reveal nighttime pressure. A stubborn sore may be the warning you cannot ignore. 10 seconds in the mirror will not diagnose you, but it can tell you when to stop ignoring something. How old are you right now? Write your age in the comments below. A 52-year-old tongue and a 76-year-old tongue differ greatly. Dentures, diabetes, dry mouth, and prescriptions change the story. Write what you noticed when you looked today. White coating, cracks, burning, teeth marks, or a red patch. Maybe you noticed nothing unusual at all. Your comment may make someone else look for the first time. If this helped, send it to someone over 50. A parent, spouse, friend, or neighbor may need this. Most people wait until the body starts shouting. Prevention begins when you learn to hear the whisper. Subscribe, hit like, and help this information reach someone early. A small warning is easier to handle than a serious diagnosis. Your body is already speaking to you. The question is whether you are willing to look.